Welcome to Vital Signs. I'm your host, Jen Gaudet, sharing what's real and relevant in healthcare, wellness, and peak human performance. We are empowering everyone to take control and advocate for your greatest asset, your health. Remember, this show is for educational purposes only. It's not meant to be taken as medical advice. Always check with your healthcare practitioners before changing any of your healthcare routines. I'm really excited today about our guest. We are welcoming back guest expert Bonni London, registered dietitian, founder, and CEO of London Wellness. Welcome back to the show, Bonni.
Thank you. Glad to be here.
Me too. Bonni, we've talked a lot about food as medicine, the power of nutrition to help us become really peak human performance and have that optimal health. Let's talk about a topic that's on a lot of minds today, heart health. Tell me a little bit about how nutrition and what we know about nutrition has changed over time. What are some of the key dietary changes for managing things such as high blood pressure and high cholesterol?
Okay, well, just the overall big topic of cardiovascular disease, which still, by the way, is the number one killer. So it is obviously huge. So this, beyond what most people believe as the major cause of cardiovascular disease, it's actually not cholesterol. Not to say that it doesn't play a part, because it certainly does, but it actually has to do with inflammation and overall metabolic health. So that is the number one thing we can do. So what I guess I am speaking about is looking at your blood sugar, your something called your A1C, which has to do with your measurement of your glucose over 3 months, would be a really good indication. And as far as looking at your lipids, you really want to look at your triglycerides versus your HDL cholesterol is actually a more important measure. And as far as dietary recommendations, okay, everything is kind of the opposite here. I am going to say we need to back off of those starchy carbohydrates that are driving up your glucose levels, which I just discussed, which is related to something called insulin resistance. And this is really at the underlying cause of cardiovascular disease. It's considered probably number one.
You know, over the years, and I've been following this for many years. I was in sports medicine in the late 90s, 2000s, and what we have heard about the causes of things such as cardiovascular disease, stroke, all of these medical conditions and diagnoses has changed tremendously over time. And you brought up, avoidance of the more starchy things. You talked a little bit about inflammation. So I'm going to ask you a question. May seem off topic, but I think it's going to come up based off of what you already said. And that's, there's a lot of talk about the anti-inflammatory diet and what that looks like. And some people, if you Google search this, you see everything from only eat animal sources to only eat plant sources to all these different things that are out there. Can you shed some light on how do we actually decrease the inflammation? How do we actually balance our blood sugar so that we can avoid some of these conditions?
Yeah, no, that is an excellent question. And I would say there is not the perfect diet, but certainly sticking with whole foods. So if you do eat animal products, certainly high quality meat, vegetables, fruit, things that do not have labels, and then staying away from the processed foods. People, I think, are getting abreast to, let's just say, bread, pastas, pastries, things like that. And then really, really critical is actually avoiding the really dangerous fat, because we have been avoiding the wrong kind of fat over the past 50 years. So the fat that we really want to be thinking about getting rid of is the seed oils or vegetable oils like canola oil, soybean oil, safflower oil. It's in everything. And yes, these things build up in our body, and they have really been linked with systematic inflammation. And I'm not just talking about all kind of oils like from avocados, those are healthy, or even omega-6s from almonds would be fine. What I am speaking of is the ones that have been processed. in the bottles, like the soybean, again, stuff that's in salad dressing, potentially, because actually our body doesn't recognize these things. And we know now that this is something that can really be part of this whole insulin resistance problem.
Well, hold the phone. I'm going to say I know what people are thinking. No salad dressing, but salads are supposed to be so healthy. What am I supposed to do if I don't put any dressing on it? What do I do instead?
I no, this is one of my big bugaboos, Jen, and I'm glad you said that because people go out to eat and they think I am making a healthy choice and I'm choosing a salad. So certainly I have no trouble with high quality olive oil, vinegars, and all of that. The unfortunate thing is that even at restaurants, frequently they might be using bottle dressings. So I would encourage the people watching to turn those bottles around and see the ingredients because quite frequently there's canola oil. There's even high fructose corn syrup. That's right. So this is what we're pouring on our lettuce.
So the salad is okay. Just be very educated and understand what we're putting on top of the salad. So
Yes.
I just want to reiterate what she said for you guys at home. It's not eliminate fats, all fats from our diets, avocados, nuts, high quality olive oil is okay. Is that am I missing anything? It's let's
Yes,
get
and
rid of
even
all the processed stuff.
and even let's touch on saturated fat for a moment because this is the fat that has been demonized beyond anything else. And ironically, I will share with you that guess what? When we eat too many carbohydrates, you know what your body produces? It produces saturated fat in your body. And there is some good evidence that actually the fat that is saturated in dairy products actually has a benefit for cardiovascular disease. So what we really want to stay away from is also heating up any of the fats. So even healthy olive oil, when you start seeing it smoking, which I would admit I do like making things crispy, so don't do that.
Okay, so what are some of the things that we can do if we're looking at this at home and let's just be real, like the economy is crazy, we're making different choices at the grocery store, maybe for an economical standpoint. How can someone develop that heart healthy eating plan on a budget? Because we're all on a budget these days.
Sure. I mean, I think it can be actually pretty simple if you're willing to make your own food. What I find with people, that's where the biggest expense goes, is finding food that's already partly prepared or made. And then I'm sure everyone has heard going on the outskirts of the grocery store, which I definitely agree with. Things that don't have packages, meat, it doesn't have to be grass fed. You're still going to be better off, obviously, getting a piece of meat that's not processed and breaded and pounded in a frozen food section. And then, of course, I would still like vegetables, obviously, and the healthy fats, and staying away from those high glycemic, which means foods that really raise your blood sugar high as much as you can, would be number one. And I would mention it's much more important to be thinking about the foods that we need to get in, because it is unlikely a few bites of something, I hope not, potato, rice, whatever, is going to cause some damage, but really think about front loading with those other foods that are going to help with your blood sugar. There's even some research in the past couple of years showing that actually, if you eat those foods first, I'm talking about the vegetables and the protein, before you indulge in a little bit of the starchy carbs, it actually has a much better impact on your ability to control glucose. And if you heard me earlier, that is really the name of the game here relative to cardiovascular disease.
And so talk to me a little bit about, really briefly, because we are going to have to break for commercial shortly. What about those who are practicing vegetarianism or veganism out of principle? Like, how can they make sure they're getting the protein and avoiding those starchy vegetables? Because there's a lot of starchy vegetables, for example, that they may be eating because they have some protein within them. How can we look at that?
Well, this is a good question. And I'm going to tell you, first of all, I would tell you to stay away from all of the alternative burgers because there is a tremendous amount of research on those now on how processed and inflammatory they are. So sticking with still whole food sources such as tempeh, which is from soy. There are definitely whole food options that vegetarians, vegans can definitely enjoy, but it definitely would take you a little bit more work.
Thank you so much for that. And, I think about that a lot because I come into contact with a lot of different people in a lot of different cultures. And it's really hard sometimes to ensure that we're getting all the things we need, all the nutrition we need. But I just want to recap before we break for commercial because, Bonni, you dropped some amazing tips. It's start with your protein, start with your healthy fats, start with your low glycemic index vegetables first. Fill up on that, which, by the way, is nutrient dense, folks. Then you're getting the vitamins and minerals you need so that you can function as well as your macros. And then after you've filled with those servings first, then you indulge in some of the higher glycemic index fruits and veggies. Did I miss anything before we break, Bonni?
Well, this isn't food, but of course, staying physically active is also huge to burn off that glucose, which is not really on the diet part, but I can't help but mention that would be critical.
Absolutely. And so if you're watching at home, make sure you're getting those healthy fruits and veggies, those healthy proteins and those healthy fats in. And then always take a 10-minute stroll after you eat so that you can make sure you're absorbing some of those that blood sugar and helping your digestion along. We do have to take a brief break, but we will be right back after these messages. Welcome back to Vital Signs. We are here with our guest expert, Bonni London, registered dietitian, and we are talking about cardiac health, how to construct our diet so that we really are taking care of our bodies, because that's our greatest asset. So Bonni, we were talking in the break a little bit about the fear that happens sometimes when we get our blood panels, we go for our wellness visit, we go to the doctor and they go, your cholesterol is high, you need to immediately get on XYZ medication. And so what are some things that you would like the population to know that are other alternatives or other things to consider?
Right. Well, first of all, I think LDL, it's a very simple marker, and there's actually different kinds of LDL. There's small, dense, and then there's the oxidized LDL, which is even more dangerous. So I would have a meaningful discussion with my doctor about my risk factors and maybe doing some further testing, because you want to see, do you actually have a disease going? And how we might test for that is a coronary calcium score, which has become really popular, just to see if we actually have plaques that have already formed in our arteries. So I feel like that would be a good place to start before jumping into a medication that is not without side effects, I would suggest. So I wouldn't be afraid. I mean, it takes, how many years to get cardiovascular disease? Nothing's going to happen within a week or two.
Yeah, and I think it's really important that we are informed when we go to the doctor. So I do want to transition into thyroid health because that's a big topic right now of conversation. But before we do, what are the questions to arm ourselves with before we go into that scary conversation?
About cardiovascular disease? Mm-hmm. I mean, about the LDL cholesterol? Mm-hmm. Well, yes. Well, first, I would want to look at the entire lipid panel, not just LDL and HDL. It's too simplistic. And actually, one of a much better marker of looking at your risk factor is taking your triglyceride and dividing it by HDL. And this actually is an indication of your metabolic health, and you want it below 2 at the very least. So looking at that number with LDL would help have a more meaningful conversation along with the other marker, which I discussed earlier, which is your A1C, your hemoglobin A1C, which has to do with the glucose over the course of 3 months. And then if they insist that you should be taking this, I would want to know how long is this going to actually extend my life? I think that's a good question.
I think absolutely that was fantastic, and we're in an informed age, and it's important for us to advocate for our health. That's what this show is all about. So thank you for sharing that. So if you're listening to this, write those questions down. Be armed with that knowledge so that you don't just end up on medications forever and ever and ever that may or may not have side effects. Come informed, ask the questions, advocate for yourself. So let's shift gears a little bit, Bonni, and talk about thyroid health, because there's been a lot of talk about thyroid health. I don't know if you are ever on social media. Like, I'm inundated because I'm a woman of a certain age. And when you get to a certain stage in life, you get all of these targeted ads. And so that's one of the things. I'm bombarded by stuff. And as a fellow prior healthcare practitioner, I'm very concerned about what's being put out there. So what are some of the factors, specifically in a dietary stance or a nutrition stance, what are some of the things we can do that can impact thyroid function and really manage any dysfunction that we might be experiencing?
Well, certainly just, your basic healthy eating is still going to be foundational, although it may not be enough. So again, just looking at whole food sources, meats, and healthy fats, vegetables, and once again, really staying low on those carbohydrates. Now, specifically with the thyroid, we do really want to consider a couple things. Number one, a large majority of people who have hypothyroid, which is when it's low, is caused by an autoimmune condition called Hashimoto's. So you really want to find out and get tested if you have the antibodies for this condition, because there is specific diets, such as avoiding gluten particularly, that can be helpful in also thyroid condition. And also, okay.
No, well, I was just gonna ask you to go a little bit deeper into that, because we should not be self-diagnosing. So you're a dietitian. What are some of the things that you look for, or when you're with a client and you suspect they may have Hashimoto's or hypothyroidism, like what are some of the things that we might be experiencing as people watching this show that are an indication of, hey, this might be something to get checked out?
Yes, thank you. No, you absolutely should test and not guess. I am in agreement with that. And certainly as a dietitian, I don't diagnose anyways, but it's something to check out. Well, low energy, obviously feeling like your metabolism has slowed down. Another telltale sign is thinning of the eyebrows, by the way, and definitely hair loss could be another thing. We know when we're not feeling up to snuff. And if just making those basic, diet changes, if that doesn't change it, we need to dig a little deeper and see what might be going on. We don't have to accept it. Oh, I don't know if I mentioned, but brain fog, that seems to be a big one with people with the, not just Hashimoto's, but with having the thyroid conditions.
So we talked a little bit about hypothyroidism and feeling sluggish and low energy. What about the other side of things? Because hyperthyroidism is also something that people encounter. Like, talk to me a little bit about that side of dysfunction.
Yes. So what you're talking about actually is mostly caused by another autoimmune called Graves' disease that causes hyperthyroidism, which also can be of a concern. And you can have the other extreme where people start losing weight, shaking. I even had someone who was like losing fingernails. Basically, the thyroid communicates to every cell in your body. So, racing heart, that can be another issue. So those were other signs to look at. But certainly I believe when everyone goes to their doctor for their regular checkup, they're always checking at least the TSH, which has to do with thyroid function. But I would tell you it is from the pituitary gland. So I encourage patients to get a full thyroid panel to really see what's going on. And that has to do with getting something called your T4, T3, reverse T3.
Yeah, and one of the other things, being in the industry, we've seen what's normal has changed, and some people are still using old norms. So share with us, like, what should we be seeing? Like, what is a healthy number? Like, what are our healthy numbers? Because some labs still give you a range, and I'll be frank, sometimes you're in range, but it's still low for you or high for you. So what do these other labs tell us? Like, what are some of the things that are a resource where we can go so we can learn more?
Well, I would go beyond the numbers because you hit the nail on the head. We need to look at the person sitting in front of us, like all practitioners. And there's actually a book with this title that even though my thyroid is normal, quote unquote, and the numbers are normal, I'm still experiencing X, Y, Z. So although they are important, I would tell you that it's still one piece of the pie. And there are a lot of resources out there. One thing I will mention that is really important with thyroid functioning is looking at gut health, because actually where we convert T4, which is what mostly people get the medication, is in T4. We are looking for it to convert to T3, which is the active form of thyroid, and that happens in the gut. So if your gut is not functioning properly, and many people have issues, that is going to put a kibosh on this, right?
Oh, absolutely. You know, gut health is so important in so many ways. I mean, you can eat all the right foods, we can be doing all the right things, but if our gut isn't functioning properly, we're not getting the nutrition that we want or that we think we're feeding with. And we are going to have to break soon, but talk to me a little bit about iodine. Iodine is a big topic with thyroid health. What can you enlighten us on that
Yes,
relationship?
this has been very interesting to me because I think the recommendations and the science has changed, where there used to be a total fear factor of giving people iodine because of the relationship with triggering Hashimoto's and hypothyroidism. So I still think we need to be a little bit cautious, but it's very important for your thyroid producing these hormones. It needs iodine. So we really want to make sure we don't have too little or too much. So it is very important. And there are tests that you can do to see if you are deficient. But I would say that I do recommend iodine for quite a few people. And so yeah, that's it.
It's really fascinating, you know, and science changes. If you're listening to this at home and you're like, well, how do I know what science to follow? Science changes as the tools to measure change. Like what we knew in the 90s is not accurate anymore because we've gotten better. We've asked better questions. We've got a bigger base of research. And the tools that we're using now have evolved. So we're able to dig even deeper. Bonni, if people are watching this and they're like, okay, great, I want to know what's right for me and my diet, and they want to reach out to you to learn more, how can they reach you?
Well, sure. On my website, it's londonwellness.net, and there's a place there to book a discovery call or my telephone number. You can just call me up right there.
And is there anything that you want to leave, any other last minute thing that you want to just impart today to our viewers?
Just because it is common and everyone might have these issues, it doesn't mean it's normal, and you don't have to settle for it. I think we can all live healthy and feel fantastic every day. So that would be it.
Thank you for that and your sage advice. Folks, you heard it from the guru here. Make sure you're eating whole foods. Make sure you're getting healthy fats. Don't be afraid of eating fats. Eat healthy fats. Avoid the processed foods. And really focus on what is your gut health, what are you putting into your body, and how can you optimize your health by taking in the nutrition that your body needs. We will be right back after these messages. Welcome back to Vital Signs. If you're just tuning in, you're going to want to visit nowmedia.tv. Click on shows, go to Vital Signs for the first half of today's show. It has been pure gold. Remember, this show is for educational purposes only. It is not meant to be taken as medical advice. Always seek advice from your healthcare practitioners prior to changing your healthcare routines. we're going to shift gears just a little bit and introduce our next guest expert. We have here in studio Dr. Andr Doe, founder of Alate Health, board certified interventional radiologist. Welcome to the show.
Thank you. Thank you for having me.
So it is September. September is Prostate Awareness Month.
Yes,
I know, guys, we don't want to talk about this. It's such a fear factor. But Doc, talk to me a little bit about why is it important for men to have an awareness about all the things that go on with their prostate, and what are some of the common issues that they might encounter?
Well, I think a lot of men don't realize how common these problems are. Over 14 million men in the U.S. have enlarged prostates. And by the time you hit your sixth decade, that's about 50% of the population that will have an enlarged prostate. Because it's so prevalent and it starts very slowly and ends up, to the point where patients can't sleep through the night because they're getting up to urinate. They don't feel like they've ever emptied their bladder completely. They're going to the bathroom all the time. It's really, not only does it cause health effects, but it also interrupts your daily life, and it really can impair the quality of your life. And it really is something, the longer it goes unchecked, the higher the side effects and the more likely you can have poor outcomes from treatment.
So talk to me a little bit about how early do we need to be considering this? Like what is the time frame on this when men should start getting checked regularly from an early detection and prevention standpoint?
Well, the easiest way to screen men is with just a simple piece of paper, questionnaire, see if they have any symptoms at all. And that should start after the age of 40.
Wow, that's early.
Yeah, it's pretty early, but it's just so common that it's really better to be thinking about it early on, even before symptoms set in, than it is to wait until it's too late.
Okay, so you were talking to me a little bit about BPH. Talk to me about what exactly is BPH. What should they be looking for? What should men think about as far as typical symptoms, and how can they watch for this?
So BPH stands for benign prostatic hyperplasia, or an enlarged prostate that isn't cancer. Cancer is the other reason your prostate can get large, but because of the location, they can cause the same symptoms. So that's the first step, is figuring out, is this something just enlargement, or is this something far worse? And then once we know that it's just an enlarged prostate, then we're going to start to look for symptoms like urgency, feeling like you have to go to the bathroom right away, or going to the bathroom a lot more than you normally do, feeling like you didn't empty your bladder fully, feeling, full when you don't think you should be full as far as urine goes, and then trouble starting the stream. You're standing there at the urinal waiting for the urine to come out. Those are all the classic symptoms of having an enlarged prostate.
And so you talked earlier about screening beginning at age 40. Is that when we maybe start to see some of these symptoms? And what's the trajectory? Is it sort of like a slow burn where it's just a little bit when we notice, or is it kind of like overnight we start to have these symptoms?
It's more of a slow burn. If it's just the BPH, it tends to take a little longer to onset. And as men, we're very stubborn. So we think, it's just a little mild something or other, and we're not too worried about it. But what we're finding out as treatments get more and more utilized and get more and more effective, that the men that have waited a really long time, they start to affect the other organs that are associated with urinating, like the bladder and the kidneys. So that will kind of cut out the number of treatment options you have if you wait too long.
And I know that you are cutting edge with treatment for this. Talk to me a little bit about what are some of the treatments that you guys are employing for BPH, and how is that different from traditional what we used to hear? I mean, there's fear around everything that to do with down there, whether we're men or women.
Yes.
And so, how has that changed over time?
I think one of the biggest reasons men haven't sought out treatment for an enlarged prostate or for these symptoms is because the treatments up until a few years ago, maybe as little as a decade ago, weren't great treatments. It was basically a drill bit up the penis and cutting out that tissue and opening up the channel so you could go.
I know everybody at home is cringing, going, that just does not sound like anything I want to do today.
And for years, that was the only option. So now there's multiple different ways to do the same procedure, but there's also much better procedures that we're offering, where we go in and we manipulate the blood supply. And that is just as effective as these other more invasive treatments. And the best thing about it is you're in and out very quickly. You do have to wait a little longer for the big improvement to take place, but that's because of the nature of the organ and the nature of the treatment. We're not just going in there and cutting tissue out. We're going in there and we're kind of taking out these cells so they don't make the tissue as fast. So it has a little bit of a lag as far as symptom relief, but once the onset is there, it's just as good as the other treatments.
And so what I'm hearing from this is get screened early if you have any symptoms. If you're sitting at home, guys, and you're like, I'm having a little bit of trouble with any of the things aforementioned, it's time to get screened. It's time to get looked at. And it sounds like these new treatments are earlier treatments because it prevents it from getting worse over time.
Yes, definitely. And what happens is with any of these treatments, once we open up that blockage that's caused by this huge prostate, then we have to get into, will the bladder recover? Will the bladder work normally? Are the kidneys 100% operational, or did they get damaged from being backed up for so long? You know, these are the reasons, as I said before, you just don't want to wait. There's no reason to come in, seek out one of these treatments. It's outpatient, you're in and out of the office in less than half a day, and you're on your way to recovery. And because of that, because you can forego these invasive surgical procedures, I think once we spread the word, more men will seek treatment.
It definitely sounds like that. So talk to me a little bit about risks and benefits, because we're talking about something that's been relatively new in the last couple of years. It's effective, it's less invasive. Are there any risks really that gentlemen should know about?
So the majority of the risk involved, or the risks that we actually see, are at the puncture site. We're going to puncture a blood vessel, so you get some bruising, maybe some swelling, maybe a little what we call a hematoma formation, but tends to not be very significant. The other things we worry about is when we're in there cutting off the blood supply, we want to make sure we're cutting off the blood supply to the correct place. And that's just something that comes with experience. At Alate Health, we've been doing these since 2016, so we're very far ahead of the curve, and we have a lot of experience doing this procedure. Other complications, which are the same complications with other prostate surgeries, the prostate can swell and can cause you an inability to actually go at all. Now the difference with our procedure is you won't leave the office with a catheter in. All the other ones you will, and I know a lot of men are so worried about having a catheter to urinate, so they won't need that after this procedure. The prostate could swell, and you could end up needing that further down the line, but it's pretty rare.
Well, it sounds pretty phenomenal. And so we talked about the risks, and talk to me about the benefits now. I just heard one major benefit, no catheter. And for somebody who was in healthcare for 20 years, catheter's never a good idea.
Yes, no one wants catheter, infection rates, things like that. But the benefits of this are, it's just as durable as the invasive procedures. At 10 years, we're both 80% successful. And it goes to helping you urinate to a more normal pattern, as well as increasing your quality of life, because now you can sleep through the night. Now you can, hold off and take a longer car trip. You're not searching out or making sure you've planned out every place that could have a bathroom when you're going. So I think these things are, really benefits to the quality of your life as well as your overall health.
Absolutely, I heard it. And you guys, if you're listening, and if you're a female, and for the men in your life, it's time to start screening. You screen early, age 40, as early as age 40, screening, so that you determine that if there's a problem, and you fix it faster with minimally invasive procedures. We do have to take a brief break, but we will be right back after these messages. Welcome back to Vital Signs. We are here with Dr. Doe talking about prostate awareness. Yes, it is Prostate Awareness Month. There are so many new things going on. There's nothing to be afraid of. Early detection is key, and there are so many new procedures and technologies that can make this a more smooth transition. So Doc, I'm going to dive right into it. We were talking about your PAE and the minimally invasive procedures. Are there any specific criteria for candidacy for this?
Well, obviously, we have you fill out the questionnaire, and there's certain scores, and you can find that right on our website at alatehealth.com. You can fill out the questionnaire. There's no obligation by doing that, but it gives you an idea of whether or not you have enough symptoms to seek out treatment. And also, the only patients that wouldn't be a candidate are either patients with advanced vascular disease where we can't get to the blood vessels, or patients that don't have an enlarged prostate. They may have prostate cancer, or it may be a side effect of some medication they're on.
We were talking a little bit about other things to consider about men's health, really, in the break. And so you were talking about some of the side effects of medication for other things. Talk to me a little bit about how medications could impact the same sort of symptoms and the same sort of challenges that you're seeing with prostate.
So with the prostate, when it gets enlarged and we start to get symptoms, the first line of therapy is always going to be something medication-wise. And if you can take a medication, you don't have side effects, and it treats the problem, then that's fine. Now, the problem arises with some of these medications. We used to think it was as simple as we age, we get too much of this substance. So if we block that substance, then we won't have that issue. And we found out not only is it not that straightforward, but this medication that many people use called finasteride can have significant sexual side effects. And unfortunately, some of these can be permanent.
So how do we determine, as patients, how do patients determine what treatment is best for them, especially when we consider medication's not invasive, but some side effects might cause permanent issues?
Yes, and one of the other very common medications causes severe dizziness. Many of my patients will come in and say, yes, I tried it, but I couldn't tolerate it. So medication can be the answer, but not always. So then you have to start thinking about these definitive therapies. And as we talked earlier about the more invasive surgical approaches, that also carries with it a much higher incidence of impotence or erectile dysfunction, if you will. The prostate artery embolization has zero chance of erectile dysfunction, as well as patients who undergo invasive surgical treatments will have a chance of having urine leak indefinitely for the rest of their life. And that also is not seen with prostate artery embolization.
And so you spoke a little bit about incontinence, leakage. Is that something that is a advanced form of dysfunction of the prostate, or is that, oh, we're too late, we're too far gone, we have to have something more invasive?
That can be associated with just having a big prostate in general, and then it can also be a side effect of some of the treatments. But prostate artery embolization doesn't have that side effect.
Fantastic. And so as we move forward, we like to talk about prevention here, and you said there really is no way to prevent this, but are there any lifestyle things that could exacerbate this?
As far as we know, other than ignoring the symptoms, we haven't really, honed in on what factors really affect enlarging the prostate. As I said, we thought it was as simple as blocking one of our normal hormones, if you will, and it hasn't turned out that it's that straightforward. So time is the biggest reason to have an enlarged prostate, so don't wait around to seek out treatment. And as far as preventing it, really prevention is in the form of early treatment and early access to treatments.
Early detection is best. We see that time and time again with all kinds of things. If you treat the problem when it's small, it's a smaller solution. But if you wait until it's big, it becomes much more challenging and could have other health impacts. So this is the month to raise awareness. What can our viewers do to help spread awareness about prostate health and help men learn more about what is important for them as far as early detection and screening?
Well, the first step, as we said, go on over to our website, alatehealth.com, fill out what's called an IPSS, or International Prostate Symptom Score questionnaire, see where you fall as far as your score. If it's high enough, talk to your primary care, come and see us, whatever it may be. But the big thing is answer the questionnaire just to see. If it's nothing, great. Maybe do it again in 5 years. But really, just be aware of it. And if you want to spread awareness of this, we have great testimonials from patients that have gone through it, have experienced the procedure itself and the benefits of the procedure. Take a look at those videos. talk to other friends. You'd be surprised if you're over 60 and you're standing with 4 of your male friends, chances are at least 3 of them are going to have an enlarged prostate.
That's a staggering statistic. So tell me some final messages that you have for men who are watching this and maybe a little bit hesitant to get checked or seek treatment.
Yeah, so now there are many more treatment options. That's the biggest thing. The standard surgical invasive option is really not the only thing that's there. And even countries in Europe now are making the prostate artery embolization the first line of therapy. So get out there, explore your options. You don't have to fear all the things that we had to fear when we only had one treatment, when everything looked like a nail because all you had was a hammer. Really go out, do your research. Most of my patients these days are great because they've done their research, they ask good questions, they know what the options are. And God forbid you're in that 20% that don't get full relief, you can still have all the other procedures. So seek treatment, seek advice, take the IPSS on our website, and hopefully, if you need anything, we'll be there to help.
And that website again?
Is alatehealth.com.
And so when viewers are thinking about this, when they're overcoming the fear of getting checked or getting treatments, is there anything else that you absolutely want them to know that can help get them over that fear edge and coming in?
Yes, many men go through this. You're not suffering alone. And even though this is a newer procedure, it's as good as the procedures that are out there and better than some. So you don't have to worry about it. And we're going to go in through an artery in your leg, so we're not going to be anywhere near your manhood. So that's totally safe.
That is what men around the world need to hear. We have something that's not the old way of doing things. There are treatments out there that are minimally invasive that can actually correct your problem, help you with what you need help with. It is so incredibly important that we know and we spread the word about getting checked. Early detection is key in everything to do with your health. But for September, we really want to focus on getting our men screened and taken care of so that you can live the best quality of life. Okay, Doc, anything that we didn't touch on today that you really want to make sure that our viewers know about?
Oh, yes. One last thing, especially in the world of prostates. The old algorithm was you go see your doctor, he checks your prostate level, your PSA, and if it's high, they send you to a urologist and you get a biopsy. That's actually not the way we do it anymore. That's another thing that many men will fear. Their older brother or their father or their uncle, somebody had to have a prostate biopsy, which, even though it's the way we found this procedure, thankfully, that's not the way it's done anymore. Now you have to go in and get an MRI, and it's much, less invasive, much more comfortable. So, even the diagnosis, even the evaluation of the prostate has gotten much easier and much less invasive. So, seek out help if you think you might need it.
Thank you so much, and I really appreciate you coming in here and raising awareness. It's important. Folks, if you are at home and you are a female watching, think about the men in your lives. If they're 40 or older, get screened. There's an amazing screening tool on Dr. Doe's website. What was that website again, Doc?
Alatehealth.com.
Alatehealth.com. That is a perfect first step. If you are a man watching, go and fill this out. There's no harm in filling out a screening tool. There is no obligation to buy, but all there is information about, hey, maybe something is going wrong. And last but not least, I really want to emphasize that treatments have changed over time. Don't be afraid of what your dad, your granddad, your older brother went through. The times are changing very rapidly, and early detection and treatment is key so that we can continue to live our best life, and really our most quality life. And so if you're on the fence, if you're afraid, don't fail to reach out to Dr. Doe. I'm sure he and his team are amazing. They're really great at walking you through the process and making sure that you are in good hands with your manhood. Thank you for joining me again today. It's always a pleasure, Dr. Doe. We are unfortunately coming to a close. All good things do come to an end, including this show. But the good news is we will be here same time, same station next week. Until then, make sure that you share the message, get the message out about prostate health and awareness. Take those screening tools, gents. And if you're a female, send that to all the men in your life. Let's make sure that we are living our best, healthiest life and taking care of our greatest asset, our health. We will see you same time, same station next week. Until then, have an amazing rest of your day.
This has been a Now Media Networks feature presentation. All rights reserved.